Chair recognizes Representative Guerra.
Members, my amendment will take a total of $500,000 for the biennium, $250,000 per year. From the appropriated $70 million under the Governor's Tourism Program, these funds will be utilized to combat the Zika virus here in Texas. And we pulled it.
Members, we're on page 63. 64. Correction, we're on page 64. 64. 63 was pulled down. We're on page 64.
Go again. We're all on the same page. It will be hard to get tourists to come visit if the Centers for Disease Control issue a travel warning for Texas due to the spread of the Zika virus. Members, as I am sure you all know, the Zika virus is here in Texas, with more than a handful of confirmed pregnancy cases in South Texas that are being monitored by local public health officials. With such a mild winter, we have seen the numbers of locally transmitted cases grow. Keep in mind that mosquito season doesn't officially kick off until May. That is why it's imperative that the Texas legislature take action now to take necessary steps to adequately fund Zika virus preparedness and prevention. Mr. Speaker, I move for adoption.
Representative Krause, for what purpose?
Mr. Speaker, would the gentleman yield for a
Will
question?
the gentleman yield?
I will.
Gentleman yields.
Representative Guerra, are you aware that this is taking money out of a dedicated account, the tourism a dedicated account?
Well, actually, pursuant to the calendar rule that we just passed before we started this process on the give and take, there should be no objection to this.
Well, and whether or not you object to it or not, the money that is being sought to be taken and put somewhere is from a GR dedicated account. So I'm afraid that if this were to go through and they actually tried to write the check for the money to the account you wanted to, they would not be able to do so.
I disagree, pursuant to the calendar rule that we passed, but also keep in mind that tourism is very important to Texas. I understand that, but 0.07% of $70 million would be put into this effort. It's very, very important that we not only track the Zika virus, but we also make sure that we provide adequate information to the public about how to prevent it. And look, folks, May is not even here.
Yeah.
The Zika virus season has not even started. I would rather be proactive than reactive.
And Representative, are you aware that Congressman Cuellar in Washington, D.C. has already earmarked about $25 million for Zika prevention in Texas in the federal budget?
Well, I just want to make sure that, especially along the border, where we've been seeing these cases, that we're protected. But the main thing is that we make sure that we advise the public about the purpose of making sure to take preventative measures for this type of situation from happening.
Well, and thank you, Representative Guerra. I do agree that it's important. I just think you're going to run into trouble if you try to fund this money into the Zika account from this dedicated account, because the tourism account is not going to be able to fund what you're going to. But I will oppose the amendment, but I appreciate you bringing it and highlighting it.
Well, again, it's only $250,000 per year for the next 2 years. That's it, out of $70 million. I mean, this promotes tourism. This promotes tourism, and that's what's important about it. We need to be proactive, not reactive.
Thank you, Representative.
Representative Canales, for what purpose?
If I could ask some gentlemen some questions.
Will the gentleman yield?
Yes, I do.
Gentleman yields.
Representative Guerra, you mentioned earlier there have been, I believe, more than 5 confirmed cases along the border of Zika.
Oh, indeed.
And the other thing that we are the front line, so the areas that are infested with Zika or where the proliferation of Zika is South America and Mexico, is that correct?
Well, yes, but it has already hit Texas.
That's right. And it's coming south to north, correct?
That's correct.
Okay, so we're the front line. So if these representatives decide not to vote on this, there's a good chance Zika will be in their backyard tomorrow, isn't it?
Well, that's true, but let's also think about, many of these members here to go South Padre Island. They want to make sure that they can go to South Padre Island, to Galveston, to make sure that their families are safe.
We already know from what's occurring, it's moving south to north, don't we?
That's correct.
Okay, and so if this legislature doesn't ensure that we do something about it, they can't complain when their neighborhood's going to be infected with Zika because they did nothing to vote to stop it on the border.
You know, that's exactly correct. And let me also state this, and this is from the Texas Department of State Health Services. As of March 29, 2017, 180 women in Texas were evidenced with a Zika infection during pregnancy. 67 pregnancy outcomes are known. 113 pregnancy outcomes are not known. If the members could take time to look at the internet and see what happens when a child is born.
If the members would take time and watch and see how Zika has moved from South America, is now in South Texas, and will soon be in their backyards, they'd vote for this amendment.
Thank you.
Mr. Speaker,
Representative Gonzalez, for what purpose?
will the gentleman yield?
Will the gentleman
I will.
yield?
Thank you.
Gentleman yields.
Representative Guerra, I'm really glad that you're bringing up this amendment. You're only asking for $250,000, correct?
Per year for 2 years.
And so Representative Krause came up here and said that the federal government is about to put $25 million. But my concern is that when one child, one baby is born with the Zika virus, the cost for that one child is $10 million. Did you know that?
That's a very good point.
So you're asking us to spend $250,000 so that we don't end up spending millions and millions of dollars after. You're talking about prevention, aren't you?
Well, yes, I am, but let's also keep in mind that tourism is very, very important to Texas, especially the South Texas, South Padre Island, the Galveston area, all along the border. We want to make sure that people feel safe and that Texas is being proactive, not reactive, and thank you.
And this is, and while tourism is important, for me this isn't about tourism. For me this is about healthy babies, healthy moms, and really, in Texas already, we've had already 8 cases of Zika confirmed in South Texas. So if those babies are born, the probability and the cost of the state is much greater. We're saving money when we do prevention. And so I want to say thank you for this amendment. I want to say thank you for this amendment and good job.
Representative Gonzalez, thank you, and you're exactly right. Children are extremely important, especially the unborn, and I think all of us here want to make sure that the unborn have healthy outcomes. This amendment is acceptable to the author.
Representative Guerra sends up an amendment. The amendment is acceptable to the author. There is objection. Record vote is requested. Record vote is granted. Clerk will ring the bell. So Representative Longoria and Guerra voting aye. Representative Zerwas voting aye. Representative Parker voting aye. Have all members voted? Have all members voted? There being 123 ayes and 16 nays, the amendment is adopted.